My name's Lindsay Kester, and I'm a sophomore at North Posey High School.
My name's Kanaje Pfeiffer, and I'm a freshman at North Junior High.
And we have a scenario about relationships, and we're going to share to you how we feel this should be solved.
Your supervisor has given you a project to complete. There is no way you could possibly get it done by yourself in time to meet the deadline. Your coworkers have expressed willingness to help, but you are used to working alone. What would you do?
Well, obviously you don't have the time to get it done by yourself, so you're going to have to accept the offer from your coworkers and work with them, and you need to respect what they say, and they'll do the same for you.
Also, this could help you relieve stress, because if you didn't accept the help, you would stress about not getting it done, and you also let your supervisor down.
There's going to be many times in your life when you have to work as a team, whether you like it or not, so you're going to have to get used to the fact that you can't always work alone. Relationships can also make or break your future, whether it be your relationship with a professor or a coworker or even a student. You need to develop some good relationships. And also, working as a team can provide a more efficient and more effective outcome.
Working alone, you wouldn't get the mutual support you get from your coworker. He or she could help you get the support that you wouldn't get by yourself. Also, it's a good sense of accomplishment. You'll feel better about yourself for getting it done and making your supervisor happy. In summary, it's important to develop good friendship with your coworkers and develop a good relationship with anyone that you work with. Thank you.
Okay, I'm Jacob Stevenson. I'm a freshman at North.
I'm Jordan Harper, and I'll be a senior at Princeton. And we're going to today demonstrate how commuting in the healthcare workforce is a good idea.
Okay, this is our scenario. You hear through the grapevine that coworkers have been spreading gossip about you. You are so angry that as soon as you see her walk in the room, you're anxious to tell her what you think about her behavior. What do you do?
In our opinion, we decided to go out of the 4 styles of communication, the assertive style. 1 being confronting the person alone, 2 using a normal tone of voice, and 3 find a middle ground to solve your problem. By doing this, we try not to offend someone's rights or feelings. And Jacob's going to explain why this is our solution.
Communication is key in a workplace. Coworkers have problems all the time, but they need to be worked out in a reasonable fashion and manner, because these problems can go and become into a bigger problem. But these problems need to be stopped at the source before they become too big.
Sometimes you can only go so far before a higher authority or particular action takes place to solve the problem.
So in conclusion, communication is key in a workplace to making it a more peaceful and efficient environment.
I'm Dalton Sullivan, and I'll be a senior at Signature.
I'm Brandon Goodall, and I'll be a freshman at Memorial.
I'm Colin Slee, and I'll be a junior at Pike Central.
All right, we're going to talk about how ethics can be applied in the healthcare workforce, and then we'll go into our scenario. The definition of ethics is the standard of conduct and moral judgment, and ethics really kind of govern our decisions and behavior, and therefore, if we really consider ethics, they can really influence our interactions and relationships with, say, patients or coworkers within the environment. And as we learned this week, there's a great variety of careers that are all filled with thousands of decisions you have to make every day, and so by keeping an ethical mindset, you'll be able to greatly impact the ones around you and have an effective career. And our scenario is:
As a research assistant, your salary is funded by a federal grant. If the research gets positive results, the grant and your job will get renewed for another year. The research director tells you to change some of the data to indicate better results. What do you do? As a group, we decided the ethical thing to do would be to tell your boss no, not change the data, and report your boss to someone that can do something about it immediately. If a coworker or something decided that the right thing to do would be, say, he was going to change the information as his boss had asked, that he would only choose that decision because he would know that his job is at jeopardy, because the results weren't what the federal people were expecting.
Why would you not change the data? First, it's the right moral thing to do. Also, it's professional. If you lied, you risk losing your reputation and credentials. Also, you want to ensure accuracy and legitimacy of your work. Therefore, by applying ethics, you can evaluate your standards in order to do the right thing and effectively work in the healthcare system.
Okay, I'd have a drawing I'd like to show you guys to get a good visual. This is a train track, and down here, there's 5 workers right here. And there's 1 here. You're on a train here going 35 miles an hour right here. And you're going towards these people. These are workers and they have their protective gear on and they can't hear or see you coming. This person is a worker as well. Suddenly the brakes on the train quit working and you can't stop. So which path do you take? The logical answer would be take this one and kill 1 person. Okay, that's that situation. Pretty simple. But say you have the same situation, but instead of turning, the track goes straight. And up here, there's a bridge, and you're standing on it. The train's going this way at 35 miles an hour. And beside you, there's a rather large man. This is you. These people are working. The brakes stop working on the train. You can push this man and stop the train. Or you can stay out of the situation and let the train hit the people. See, some people would say, push the man and kill 1 instead of 5. Others would say, stay out of the situation, this isn't yours. It's gonna kill 5 people. So people would argue that, but ethics, this is ethics. This is a good visual for that.